This is the 3 East instructional video on how to obtain peritoneal fluid cultures and other labs. First, you're going to gather your supplies. The things you're going to need are going to be sterile gauze, blue hemostats, red-topped vacutainers, a 5 and a 10 cc syringe, blunt needles, a PD minicap, alcohol swabs, a fresh betadine, and the appropriate tubes. Note that typically a fluid cell count is in a purple top tube or a red top tube. It depends on the way the physician orders the labs. PD fluid cultures are usually in red top tubes. For the sake of this demonstration, we're going to use a purple top and a red top tube, but just be mindful to check your lab labels and use the tubes that are ordered. There are 3 ways to obtain cultures or cell counts. If the patient is dry, you're going to have to conduct a manual exchange to instill them with at least 1 liter of 1.5% dextrose solution with a dwell time of 2 to 3 hours. How to complete a manual exchange is shown in the PD manual exchange video. If the patient already has fluid instilling when they come to the hospital or they were having a treatment done through the day and you know they have fluid in them, you can drain them directly into a PD sample bag, which is going to be shown on the next slide. If the doctor is okay with gathering labs at 9 o'clock, a sample bag can also be connected to the cycler to obtain labs. This is shown in the setting up the cycler video. Note that regardless of using the PD sample bag or if you're using the manual exchange method, you are going to conduct the exact same steps that are shown in this video. It's just going to be a different bag, but the instructions are the same. So this is the PD sample bag. You can see on the left-hand side, it's attached directly to the patient's transfer set, and then on the right side, it can connect directly to the cycler. So it's the same bag if you're using it for either of these scenarios. Note that on the left-hand side, the port is circled. This is going to be the spot that you're going to use to obtain your cultures or your cell count. So if you're using this bag, that is where you're going to stick the blunt needles in. We're going to show you on the next slide how to use the manual set. So after conducting a manual exchange, you're going to cap off the patient, tape up their catheter, and then using the PD bags, you're going to have to flip them upside down. So everything you just drained is going to have to go into the fill bag because the drainage bag does not have a port on it. So make sure your blue hemostats are both at the Y site, above where it actually bifurcates to allow it to drain but not flow out. And then you're going to give it some time and let some fluid drain into that fill bag. That port is right there that we're going to use to access to get our sample. And then you can see here on the drain bag, there is no port. So doing it this way just allows for a little more control over the situation. It makes it kind of easier because you have that special port to stick the needle in. After you feel like you have an appropriate amount of fluid in there, you're going to be able to just use a blue hemostat to clamp off that line so the fluid stops moving. So that looks like there's about enough in there. So we're clamping, so nothing's going to flow anywhere, and we're going to move that bag up to a more comfortable position. Next, we're going to open our sterile gauze, and using our new iodine bottle, we're going to break the seal on that bottle and then soak the gauze in some iodine. Remember that if this is a manual exchange that you're using for the purposes of obtaining the labs, it still counts as an exchange, and after you're all finished, you should cut the bag open, drain into the canister like we normally do for a manual exchange, and count this as an exchange. So you should still be documenting the amount of fluid in and the amount of fluid drained in Epic as a manual. Okay, so we're soaking our gauze and then we're going to wrap it around that port on the fill bag. We're going to let that sit for about 5 minutes to make sure that any bacteria on there is not there anymore. After the time has elapsed, we're going to connect our syringes to our blunt needles. Remember, as we stated previously, that sometimes fluid cell counts are in purple top tubes and other times they're in red top tubes. all depends on the way the nephrologist orders the labs, so just make sure that you have the correct tube that's listed on the label. So we're going to take the blunt needle, insert it into the port, pull back and obtain our specimen. We can cap off our blunt needle, open up our red-topped vacutainer, and then we'll twist on the syringe and transfer the specimen into the appropriate tube. This is a reminder also that PD cultures are not put into anaerobic and aerobic culture bottles anymore. That's an old practice. We have that sample. So we'll use a fresh syringe and a fresh blunt needle after cleaning the port again, and we'll pull back. So each lab, each tube should have a separate syringe and a separate blunt needle. Also, wasn't shown in the video, but you should be scrubbing the tops of your tubes with some alcohol swabs prior to using the vacutainer, just in case any bacteria was laying. We don't want to skew any results. So we've connected our vacutainer, popped on our tube, and now we have our cell count. So you can scan and send your labs off, throw away everything in the sharps, and again, just a reminder that if this is a manual exchange, to cut open your drainage bag and your fill bag and make sure you're measuring that PD fluid and charting it in Epic as a manual exchange.